Okay, well, first of all, once again, we'd like to thank all of you for being with us today here on a special Zoom platform as we're going to focus on the Texas Poor People's Campaign. And first of all, my name is Robert Ashley, longtime news director, talk show host here in the Dallas-Fort Worth area for radio station Heaven 97 KHVN. And it's an honor to be with all of you today. We have a very distinguished group of fellow Americans here to talk with us today about the Texas Poor People's Campaign as we're getting ready for the national moral revival that's going to be taking place this particular weekend virtually, but the focus will be in the nation's capital. Now, many of you know that in light of all that's been going on with the COVID-19 pandemic, all of the things that we've been seeing regarding the shooting deaths of African-American men like Rashard Brooks, people like, of course, George Floyd, just a minute, Breonna Taylor, we've seen a lot that's been going on. And of course, the Poor People's Campaign is something that the Reverend Dr. Martin Luther King Jr. passionately was indeed concerned about. As a journalist, having covered the United States of America for the last 30 years, we discovered that the Poor People's Campaign was perhaps one of the last things that Dr. King was trying to do right before his assassination. Dr. King, of course, had a strategy, from what we understand. He had a very, very distinguished strategy to make sure that poor people in this country would not be forgotten. And that's been a major concern here lately with the Trump administration and those who are concerned as to whether or not this administration, do they have a heart? Are they really concerned about the least of these? And of course, we're in a presidential election year, so therefore being concerned about the least of these is indeed a moral calling that we still hear Dr. King and many, many others calling up on us to make sure that we do. So today we have a very distinguished guest. We'd like to tell you exactly who we have with us today. We have, of course, Danita Jones. And in just a minute, Danita is going to give us some historical background on the Poor People's Campaign and why it's so very important that we not forget the poor. Also with us today, we have Zoe Middleton. Now, Zoe, of course, is representing the Southwest Texas. She's the director of the Texas Housers. And of course, once again, honored to have Zoe Middleton with us today, Southwest Texas Director of Texas Housers. Also with us today, a longtime person that we've known quite some time here in the Dallas-Fort Worth area. It's considered to be a legend, a trailblazer. We have Diana Flores with us today. And Diana Flores is the Vice President of the Organizational Development for the Greater Dallas Hispanic Chamber of Commerce. And Diana has been on the battlefield in the barrio, as we say, for quite some time, representing the poor people right here in Dallas, Texas, all across the United States of America. Also with us today, we have Ali Lozano with us today. And Ali is with the Voting Rights Outreach. She's the coordinator for the Texas Civil Rights Project. My goodness, that's a powerful, powerful project there, a powerful organization. And a lot of times when politicians see that organization come, as they say in the African-American community, they will jump sometime because this Civil Rights Project here been in court dealing with quite a few issues. Now, also with us today, a legendary, some would say an earth-shattering medical official here, Dr. Joel Waggoner, the author of at least 6 books. And her approach to healing, the holistic, the allopathic approach. Now, some doctors have gone to medical school for 8 years and have never had at least 1 hour of nutrition. But with Dr. Jill Waggoner, we understand she binds, the allopathic as well as the holistic approach. Now, of course, Dr. Jill Waggoner is indeed a medical doctor, the functional and integrative medicine and the family practice, Methodist Premier Wellness. And of course, once again, Dr. Jill Waggoner, it's an honor to be with you this afternoon. Once again, the author of at least 6 books. And of course, this next gentleman here, very, very distinguished gentleman here, very distinguished gentleman, Dr. Brian Williams. Now, of course, here in Dallas, Texas, many were concerned. We lost Dr. Brian Williams to the folks up there in Chicago. But Dr. Brian Williams, the Associate Professor of Trauma and Acute Care Surgery at the University of Chicago. He's also the immediate past chair of the Dallas Citizens Board, Dallas Citizens Review Board right here in Dallas, Texas. Now, this Citizens Review Board became very, very special because back on July 7th, several years ago, we had 5 police officers who were shot and killed. And the city of Dallas, it was the middle of a protest demonstration, and the mayor at that time, Mike Rollins, called upon Dr. Brian Williams to come in to try to help the city of Dallas heal. And as a medical official, he did more than just that. He was a salve on a wound that basically had an impact on our society. So once again, for the next hour or so, we're going to talk about the Texas Poor People's Campaign as we're getting ready for the pre-event that's going to be taking place in the nation's capital this particular weekend. Right now, let's go to Danita Jones. And Danita, if you could just give us some background about the Poor People's Campaign itself.
Okay, so thank you so much, Mr. Ashley. The Poor People's Campaign is a national call for moral revival, is an intersectional moral fusion national movement. And we're anchored by two distinct groups, the Repairers of the Breach and the Cairo Center for Religion, Rights, and Social Justice. The campaign is organized by poor, marginalized, religious and moral leaders and advocates, and is co-chaired by the Reverend Drs. William Barber II and Reverend Lily Theo Harris. The Poor People's Campaign, we are committed to a multi-year long-term struggle and organizing drive to unite our country from the bottom up, to challenge the interlocking injustices of systemic racism, poverty and inequality, ecological devastation, militarism, and the war economy and the corrupt moral narrative of religious nationalism. We are people who challenge the false narrative of religious and Christian nationalism. We are impacted by and fight against voter suppression, systemic poverty, immigrant justice, police violence, school resegregation, low wages, homelessness, and unjust housing, lack of health care and access to clean water and air, militarism, and the war economy. We do not just represent isolated communities and individual stories. We represent 140 million poor and low-income individuals in this country. 12.8 million of those individuals reside within the state of Texas. And so with this virtual town hall, we want to bring awareness to our citizens of Texas to let them know how the pandemic, the COVID-19 and the systemic racism affect our citizens of Texas.
All right, well, then we certainly appreciate that. That's a powerful, powerful look at all those perspectives and some of those major demands that the Poor People's Campaign is indeed demanding. And we'd like to start with Dr. Jewel Waggoner. Now, Dr. Waggoner, we're right here in Dallas, Texas. We're here in the state of Texas. And Texas is one of the states that really opened up really, really soon. Some say it was too soon. Some wondered if indeed politics had something to do with it. But right now, Dr. Waggoner, we are considered to be in a hot zone, if you will. We have more cases here in Dallas, it seems like, than any other place across the United States of America. For the last 3 or 4 days, we've had in excess of 300 COVID-19 positive cases, and also the death toll is continuing to rise. And of course, we know who's impacted. The people of color are impacted more so than anything. So how can we deal with this, Dr. Waggoner, especially the poor people who are still having to go to work and try to pay their bills?
Well, I think, Brother Ashley, the first thing I just want to say is I'm so excited to be a part of this, because I think that it's important that we have this dialogue so we can start talking about some of these issues that are causing the health disparities. Anytime we have any kind of health crisis, it always highlights the disparities that already exist. And so we have people who, for a number of reasons, are impacted more than others. The numbers are continuing to rise, as you have stated. The hospitalizations are continuing to rise, and we are pretending like it has gone away. And so I think that it impacts us more, or communities of color and poor people and all of that, more than others, because whenever you talk about any public health crisis, you have to include all of the issues that are part of it. So in our country, we tend to isolate everything. We isolate diabetes, we isolate high blood pressure, we isolate COVID-19, we isolate poverty, we isolate poor education, we isolate all of those things. But the reality is they are all interwoven. So when you have communities that are impacted by things like implicit bias, that impacts you in this way when it comes to health. Let's say you have a cough or a cold or pneumonia or a flu, and you go to the hospital and they send you home, as opposed to letting you stay so you can be watched. There's not enough testing in our areas, and we are being bound. When I say we, I'm talking about healthcare providers. We are being bound by these rules that continue to exist, that if you don't fit into one of these boxes, then you still have difficulty getting a test. So there's so many things that we have to talk about before we can address this. But this is the first thing. We have to make sure that we're doing all the things that we can do. There are many people who can't social distance, for instance. And so what do? There are people who cannot get a test, so they don't know whether it's COVID. What do? There are people who go to the hospital and they won't test them. What do? I mean, mean, it's really a problem. And those of us who are trying to take care of these communities are bewildered by some of the issues that we're encountering.
Yes. And Dr. Waggoner, I'm sure you remember here in Dallas, there was a case where we lost a 17-year-old precious young honor student in Lancaster, Texas, who died
Yeah.
right there in the emergency room. And
Yeah.
that was one of those situations where, of course, one of the family members worked in the hospital system, came back, and the whole family seemingly tested positive for COVID-19. But I want to get Diana Flores into the conversation. Now, Diana, of course, being the Vice President of Organizational Development for the Greater Dallas Hispanic Chamber of Commerce, I can remember seeing a story about this Latino father who was working at a meat packing center, and he had come down with COVID-19 and literally died. And I think Carlos Quintanilla was representing him and his family, because it seems like a lot of the poor people are being forced to work in spite of the fact they're still sick. Let's see, Dinah might be on mute there. You might want to unmute your.
Thank you. Thank you, Mr. Ashley, and thank you to the Texas Poor People's Campaign for this very important conversation, and then the one that'll be held nationally this weekend. With our community, the same with any poor people, we're on the margins. We're also the ones that are in the most dangerous types of jobs, because as in terms of the meatpacking plants, as you know, President Trump issued an order that they had to stay open, and it's apparent that the owners, from what's been in the media, don't really care about what's happening to their employees. Sick or not, they have to be on that line working. And so it's just tragic. It's just tragic. And this type of cold-heartedness just has to end. And if we're not the ones that are stepping to the front lines and demanding that there be an end to these type of dangerous, tragic working situations, who's going to step forward for us? Because we already see that the owners and some in government don't care. We have a voice. We have to rise. We have to raise that voice. We have to demand, put these protections in place for our workers. It has to happen.
Yes, yes. And Diana, while I have you here, and in light of what we're talking about here, you know, there was a major Supreme Court decision today. The DACA program, major victory there. Now, we've heard this afternoon that President Trump, of course, as he's always like a bull in the china shop, says he's going to try to fight it and go back and appeal it, and the court's going to give him another opportunity. But in light of COVID-19, a lot of our young people, particularly in the Black and Latino communities, are coming in contact with this virus, but yet that court victory today, how does all that figure into the scenario?
Well, that was certainly a blessing, is how we see it. Because when the arguments were made before the Supreme Court to rescind DACA, according to the questions that were being asked by the justices, it seemed like they were going to grant Trump's lawsuit and rescind. So this was totally unexpected and just such a beautiful, beautiful blessing in these dark days that we've been in. You know, we have kids in cages right now in the United States of America. At least these students, these brilliant, motivated, inspirational students for right now are saved. But that's another area where we have to keep fighting until we have full, just, comprehensive immigration reform, so that they no longer have this hanging over them, the possibility that they will be ripped from what is their home because they've been here since they were small children.
Yes, indeed. All right, thanks a lot there, Dinah. Now, getting Zoe Middleton into the conversation. Zoe, once again, you are the Southwest Texas Director for the Texas Housers. Can you talk to us about the impact that COVID-19 has had on your constituents?
Yeah, thank you so much, Robert. And I will just clarify, I'm the Southeast Texas co-director, but the issues are the same across the state. We're seeing that, you know, more so than any other contemporary event, COVID-19 has shown how central housing is to both our health and our dignity. And so people have come closer than they ever have before to homelessness because of paltry rent relief programs, but also because of the way the Texas State Property Code is written, especially for renters, which favors landlords extraordinarily so. So I think that one thing that we're seeing is not only that the laws are insufficient, but also the political will is insufficient to do the right thing. Houston is a city of 57% renters, and we had a $15 million rent relief fund that was exhausted in 90 minutes. And if we have not seen much indication that other rental assistance is something that our elected representatives really care about. And similarly, we haven't seen any indication that police defunding is anything that they care about. If the budget vote that happened last week was anything to go by. And so I think what people are coming into stark realization with is this idea that the political will simply isn't there for the needs of poor people. You know, and I think people are feeling much less shame about having their needs, right? People are feeling a lot less shame about how much of their income rent and utilities take up. People are having much less shame about, you know, having to stay home from work because they're sick, that kind of thing. We've kind of broken open that thing that keeps us isolated and realized that these issues that are so interrelated are, yes, connected, and like the solutions to those issues don't need to be commodified, which is what we tend to do in this state and in this country.
Yes, and so let me just follow up real briefly. Take, for example, there's been a lot of talk about reallocating resources. In light of the protest demonstrations up in Seattle, the city council there has voted to possibly defund the police department, maybe reallocate resources. And I remember hearing the Reverend William Barber say, in light of the fact this country just came up with $2 trillion to bail America out, whereas one time we were saying, oh, we don't have enough money to care for the poor here. We don't have enough money to help the homeless here. What is it going to take for America to reprioritize its priorities and begin to care about its human capital? Because it seems like in a capitalistic system, are we getting it twisted? Do we care more about capitalism than the human capital, or what's really going on here?
I think there needs to be a total shift towards human dignity as being the thing that we care about, and the sanctity of human life as being what needs to be protected rather than corporate interests. I mean, the city of Houston made dozens of people appear in person during a pandemic to beg for rent relief because it didn't have remote public comment set up. And then the rent relief program was designed by special interests in the Economic Development Office, not the Housing Office. So we really see where the political will is right now. And I think people are frankly exhausted by it, and people are dying because of where this political will is. So there needs to be a moral revival with the people in power, as well as a coming together of poor people across the state of Texas.
Yes, indeed. All right, thanks a lot there. Let me get Ali Lozano into the conversation. Now, Ali, of course, the voting rights outreach coordinator for the Texas Civil Rights Project. Now, here in the state of Texas, Ali, you know, there's been a really big fight over mail-in ballots. Attorney General Ken Paxton, who has this SEC case hanging over his head. A lot of people have wondered, how can this guy continue to be the Attorney General with a big case like that hanging over his head? It's just incredible. But in terms of voting, people are wondering, are they going to have to risk their lives to vote? And what else is going on in your voting agenda?
Sure. Thank you for having me. So as Dr. Waggoner mentioned, what's happening in Texas is happening nationwide. This pandemic is really just highlighting already immense disparities and is also heightening considerable obstacles blocking Texans from exercising their right to vote safely. What we have seen come out of this pandemic in terms of voting has particularly and is going to particularly hit Black and Latino voters and young voters. Now, if we're talking about vote by mail, we're talking about young voters, anyone under the age of 65. And that is because Texas has some of the strictest vote by mail laws already in the entire country. We are also only one of 10 states without any kind of online voter registration. And so the Texas Civil Rights Project acted as an intervener in one of multiple vote by mail lawsuits that was happening in Texas. And I will spare everybody the enormous timeline of absolute mess that state leaders dragged us through. But right now, as it stands, as of May 27th, the Texas Supreme Court ruled that merely having a lack of immunity to COVID without any other underlying physical condition does not make an individual under the age of 65 eligible to vote by mail. But so the state was arguing that a lack of immunity to COVID was an emotional disorder. And we were arguing that it was a physical condition because a lack of immunity to a pandemic that causes death a lot of health experts agreed was a physical condition. So the Supreme Court said, if your sole reason for wanting to vote by mail was that you do not have immunity to COVID, you cannot vote by mail. But they also said that a voter can, it's basically now left up to a voter's discretion. A voter can take into consideration aspects of their own health and their health history that are physical conditions in deciding whether, under the circumstances, they should apply to vote by mail because of disability. And there is a list of high-risk physical conditions, particularly in the context of COVID, that was issued by the CDC. And so essentially the state is saying, if you do not have a lack of immunity to COVID, or if you have no immunity to COVID alone, you can't vote by mail. But if you also have underlying health conditions that fall within the CDC high-risk categories, then sure, you can vote by mail. So one, this is just immensely confusing, you know, up to a voter's discretion. I mean, we at TCRP, we have gotten every question under the sun from voters all over the state. Number one, because they do want to vote by mail, because they are afraid to go vote in person because of this pandemic. And number two, and this is the saddest part, is there is an immense amount of fear of criminal prosecution from our own Attorney General's office if people decide to vote by mail and are then investigated and found that they were not eligible to vote by mail using the disability option. That to me has been one of the most heartbreaking conversations to have with voters all around the state, is the genuine fear that they have of their own state leaders who are supposed to be expanding access to the ballot box instead of hindering it.
Well, you know, one quick follow-up to that, Ali, you know, voter suppression. We've all seen what happened in Georgia, where Stacey Abrams, that whole Brian Kemp thing over there, and there's concern that Texas could go from red to blue. Is there legitimate concern that this could be some form of voter suppression? Because it seemed like there's psychological concerns, like you said, there's fear, and also here in the state of Texas, the cases are just spreading like wildfire.
Yes, the cases are spreading like wildfire. So TCRP is a nonpartisan organization. We run a election protection hotline during every major election cycle, and we do not ask if what side of the aisle that you fall on. If your ability to vote is being hindered, then we will do our best to help. But I will say that the voter suppression tactics that have been utilized in this state are longstanding and are rooted in deep-seated racism and white supremacy. I mean, the state of Texas has an incredibly problematic history around voting rights. And particularly with communities of color, we cannot, I feel like a lot of opponents of expanding access to the ballot box in Texas really tried to make the issue race neutral, and it's simply not. If you look just at the history of our state alone, it is impossible to separate the history of racial injustice in this state with voting rights. The two are completely interconnected. And so I think also the combination of COVID-19 really impacting the Black community the most, in combination with the fact that we have no online registration and that this pandemic has essentially halted all brand new voter registration in this state, and the fact that we have now a limited ability to vote by mail. The combination of all of those things, I think, is going to drastically affect who is able to go out and vote or not this election.
Yeah, I remember having an interview with the state NAACP president, Gary Bledsoe, and I think it was testimony rendered that maybe even 600,000 people might have had their votes suppressed. Even that was some of the court testimony here in the state of Texas, as there were voting rights cases that were being dealt with. Also, redistricting, that's another political fight that you guys have been in the middle of. But there's so much I could talk to you about voter suppression, or just the whole thing about voting, but I know that that's a major concern but we want to certainly thank you, Ali, for that very detailed assessment of it. And let's go to Dr. Brian Williams. And Dr. Williams, once again, sir, honored to be able to just see you and talk to you, because a lot of folks were upset when you left Dallas, Texas, to head to Chicago. And we know that the former Dallas Police Chief Dave Brown is now the chief of police there in Chicago. But once again, Dr. Brian Williams, with you being the Associate Professor of Trauma and Acute Care Surgery at the University of Chicago, the immediate past president of the Dallas Citizens Police Review Board, and see the history of the Dallas Citizens Police Review Board, the fact that you were there, I mean, that's a major racial seemingly milestone here in Dallas to break through. But getting back to your medical profession in light of the Poor People's Campaign, as a journalist, I've been covering a lot of child abuse. I've been covering a lot of domestic violence as a result of the COVID-19 lockdown. A lot of people have been fighting over money. What impact do you feel that this COVID-19 has had on the poor families? Doc?
Well, I'm honored to be a part of this conversation, and I should also say that I'm working with Dallas Judge Clay Jenkins as a special advisor for health equity. So I'm still in this in this battle to ensure that Dallas County citizens are being healthy and safe throughout this pandemic. And as far as the impact on poor people, I don't think it's any surprise that this pandemic is having such devastating effects on the economically marginalized communities throughout the country, which also happen to be predominantly communities of color. They're already existing on the margins of healthcare, existing on the margins of jobs. So in a pandemic like this that crosses all these sectors and just really just destroyed so much, it is not at all surprised that they're suffering greatly. And the thing is, like, what do we do next? We can't just close our eyes and get through this and then wake up and move on to getting back to our lives as they were. There are significant gaps that are allowing poor people to suffer whenever there is a crisis. So we need to identify those now and start working to close those gaps. So when the pandemic is over, we already have momentum to make these lives better. It would be a lost opportunity to wake up when this is over and past and just forget about all the suffering and deaths that have occurred during this pandemic. So I applaud this panel. It's great to hear all these different sectors talking right now, because we talk a lot about the healthcare aspects of this. You know, how many are infected, how many are dying, but we tend to minimize the economic impact, the housing impact, the legal impact, the political impact. These are all interconnected. We have to address the intersectionality of all these different areas in order to truly uplift all these communities so that the suffering doesn't occur again in the future. So there's simple things that everyone can do and still do, despite all of the information we've learned and heard over the past few months. There's 4 things: wear a mask, avoid large public gatherings, wash your hands, and physical distancing. It comes down to those 4 things. Anybody can do that. We can all play our part, and that will be a benefit to everyone, not just yourself as an individual.
Yes. And Dr. Williams, the protesters here in Dallas, protesters are being encouraged to get tested. Do you have a word for the protesters?
Yeah, so Judge Jenkins' team, they have worked with the county to ensure that you can safely protest. You can get masks while you're there at the protest. They will allow you to get tested within 5 days of a protest. So there is proactive steps that have been put in place by the county to ensure that protesters can safely exercise their First Amendment rights. And let's also recognize that discussions about should you protest now or not because of COVID-19, understand that what people are protesting, that has killed many more people over generations than COVID-19. We're talking about protesting systemic racism, protesting police brutality, protesting economic inequality. Those things have caused way more deaths than any deaths from COVID-19. So it is essential for people to go out there and protest, but also do it safely. And right there in Dallas, your officials are ensuring that you can do that and maintain your health.
All right, I promise you, Dr. Brown, last quick question for you. Now, you know, speaking of County Judge Clay Jenkins, we know the judge, we've worked with him down through the years, and right now it seems like he's in the middle of a controversy with the governor over whether or not it should be mandatory to wear a mask. We have at least 9 mayors here in the Dallas-Fort Worth area that want to require people wear masks. The governor seems to think that the judge want to get people arrested. What is going on between these two elected officials with a serious situation like this?
Well, you know, that's the great thing about being a special advisor for health equity. I get to stay out of the politics and just advocate for one issue, which is what is best for the safety and health for public health. And wearing a mask is an easy, inexpensive thing that everyone can do to protect themselves and the community. So the legal ramifications of not wearing a mask, or who has the authority to say yes or no that you can or cannot wear a mask, I would just step back and just think, okay, not what they say I can or cannot do, but what should I do?
Yes.
What steps can I do to ensure that my family, friends, and the community are stay safe and healthy? Because we're all interconnected in this. There is no way to escape contact with the virus. So if we're all doing our small part to ensure that we can protect the public, then we all benefit from that.
Beautiful.
So, wear the mask. Wear the mask.
Thank you, sir. All right, and another area that I wanted to talk about, and once again, for those of you just not joining us, you're listening to the Texas Poor People's Campaign, very, very distinguished panel that we have here tonight as we're talking about the Poor People's Campaign as we're moving towards the national event that's coming up this particular weekend. Coming back to Zoe Middleton on the issue of what some may call a fake religion, those who claim to be more moral than anybody else. Systemically, if you were a moral person, would we have systemic racism? It seemed like if you were really as moral as some people claim they are, it would be rooted out of their heart. So we're wondering if some folk are just running around here claiming to be moral and saying it, talking loud, but doing nothing.
I think there's definitely a co-option of religious language by special interests, by capitalists, by people that are beholden to special interests, and there's a neutralizing of it. They forget the true tenets of most faiths, and what it actually means to be a moral person and have respect for the dignity of all life. It wouldn't, if we lived in a moral society even pre-COVID, it wouldn't be, Houston wouldn't be one of the hardest places for an extraordinarily poor person to find a home. We would not subsidize the building of luxury hotels to the tune of $43 million with a homelessness crisis. We would make different decisions, and we would put our priorities where our values are. But I think what we see now is that the priority of the people in power is, reopening the economy. The priority is preserving existing industries that do extraordinary harm to not only the people that work there, but to the communities surrounding them. And the priority also, of course, is not in the development of truly affordable housing in every neighborhood and taking care of every neighborhood. So yes, in answer to your question, quite simply.
Okay. Yes, and Diana Flores, and once again, this is a question centering around our national morality. It seems like right now, in light of the tragic death of these African-American men at the hands of police officers, there is this kumbaya moment, if you will. How sincere is that? Is that just show, or do we truly have a moralistic America? I mean, are we including the poor in all of this, or is this the kumbaya moment, and after the cameras are gone, we're going to be back to not even caring for the poor again?
It remains to be seen in terms of, is it kumbaya or does it lead us to substantive change in some areas? I don't think we're going to get there yet in terms of the substantive change, the holistic substantive change that we need to improve the lives of those that are least among us. As Zoe referred to being a capitalist society, we know where the importance is. But we do, people that have the awareness, that have the consciousness, that don't have that dichotomy within us about, our religious morality, or professing to be making up a Christian nation, while yet the government that we support enact policies that are unfair and unjust for those who are the least among us.
Mhm.
So it remains to be seen. Right now, as you know, there's a lot of talk around police reform. And hopefully that will take hold, but it'll be substantive police reform and not superficial police reform. So hopefully that, again, if it is substantive, if it is long lasting, if it is meaningful, is a springboard then for us to address other issues. But it remains to be seen.
Beautiful, beautiful. And then Dr. Williams, coming back to you, switching gears back to the issues of police brutality. We understand that this afternoon in the Atlanta area, the two officers involved in the Rashard Brooks death, one, of course, still in custody, one bailed out this afternoon. He's willing to tell the courts and testify against his partner. But how can communities work together to end police brutality and try to work with the police, or as some people say, disband the police? But how can communities come together to deal with the issue of police brutality, Dr. Williams?
Yeah, so getting civilians to work with police, there is a lot to unpack there. And I got a crash course in that when I was chair of the Police Review Board in Dallas. And that involved our board working with the citizens, the civilians in Dallas, work with the Dallas Police Department, working with the Dallas Police Associations, the various associations, and also various community activists and leaders in the different communities. So as you're going through that, navigating that, you'll find different groups have different agendas, they have different wants and needs. And so how do you bring all that together? And for that to be successful, so that's where collaboration, one, you need to have tenacity and patience, but also everyone has to be focused on like what is the goal, and that is ensuring public health and safety, right? And the police are a part of ensuring public health and safety. But if in the absence of trust between the police and civilians, you really cannot achieve that goal. So what it comes down to is how do you develop that level of trust? And part of that, a huge part of that, is beyond community outreach. It's beyond the basketball games and the community advisory boards. It's about really reckoning with the legacy of what policing means in this country and how it goes back to maintaining a social order that was to exclude Native people and communities of color and control those communities of color, right? And that may have been generations ago when those were put in place by different people who are now long gone, but the systems still exist and they're very durable. And until we have a reckoning with that and address that is still endemic within policing, then it'd be difficult to move forward. But I'm comforted that I've met a lot of people that recognize that and are willing to have those difficult discussions and move forward. But it's a lot of people that are involved across this country, a lot of different police departments. So an overnight fix is just not going to happen. But I'm with a lot of people. We've been talking about this for a long time. We've been waiting. We need to move faster to make it happen. And that involves people having to admit some very difficult truths about the past and what policing has meant to communities of color in this country.
Yes. And one other issue before we run out of time, Zoe or Ali, I think one of you all are working with the LGBT community. We did not want to leave them out of the conversation, but recently there was a Supreme Court decision which indicated that I think it was the 1964 Civil Rights Act could be used to make sure that people of the LGBT community could not be victims of discrimination. Zoe or Ali, which one of you guys are working with the LGBT community?
Well, I hope everyone is working with them.
I read your background, but I knew I don't have those credentials in front of me. One of you.
That's fine. Ali, do you want to go? I have something to say, but it's quite small.
Sure. Well, yes, we were thrilled by that ruling. And we, of course, have Black organizers to thank for that because of the Civil Rights Act of 1964. And yes, we work with the LGBTQ community across all three of our departments: voting rights, criminal injustice reform, and racial and economic justice. I can speak to the voting rights teamwork, obviously. We have been working with the LGBTQ community in order to ensure that our trans siblings, transgender individuals in Texas are able to vote without issue. We have found a significant amount of problems around both poll worker training and election administration things that when trans individuals go to vote, there is a lot of times problems with voter ID because as a lot of folks know, we also have one of the most stringent voter ID laws in the country that was passed in 2011. So we have been working in particular within our election protection program to make sure that the trans community has all of the information that they need in order to advocate for their own right to vote when they get to the polls.
Beautiful, beautiful. Well, let's see. Once again, for those of you just not joining us, we're here with the Texas Poor People's Campaign, a very distinguished group of guests with us today. Dr. Jill Wagner is with us. Diana Flores is here. Zoe Middleton is also part of this conversation. Ali Lozano and Dr. Brian Williams. I don't think we've talked about the economy, not the economy, but the environment, if you will, ecological disasters that are going on. And coming back to Dr. Jill Wagner, in terms of just our environment, are we living in healthy environments? You know, here in Dallas, Texas, we've seen so many piles of tires. We've seen dumps here, dumps there. We all remember what happened in West Dallas, a chemical toxic site there. But is capitalism impacting what's going on in terms of our environment?
Absolutely. And we are, that's part of the whole conversation about our health overall, and about, you know, when we're talking about the crises and public health crises, when you raise children or children live in an environment where they're exposed to more pollution, they play on playgrounds that were built over former lead smelters, that kind of thing, it impacts their lives in ways that leads to an increased risk of disease, an increased risk of poverty, an increased risk of being exposed to violence. All of those things impact just things like whether, you know, the air is clean and the water is clean. We don't generally think of those things as a collective, but they are. Mm-hmm. And so just like we have to fight for the right to vote, and we have to fight for the right to have good health care, we also have to think about health in general and wellness in general. And that includes things like exposure to clean air. So all of those things are very important, and we have to see them as important. So when we are standing our ground and saying we want our communities to be healthier, we're not just talking about we want to spend more healthcare dollars. We are talking about we want environments that are clean and healthy so that we can grow young people up in a place where they will have the opportunity to succeed. So all of that's very important.
Yes, indeed. And Zoe, coming back to you in terms of the environment, do we have clean drinking water all across America yet? Or we were in Flint, Michigan, we know that a lot of poor people had to drink all kinds of arsenic and everything else. So is that still a major problem for the poor people of this country?
I'm from Michigan, so no, we don't have clean drinking water. Flint especially does not. But I think we don't have clean drinking water. We have a terrible infrastructure system that's on display across the country, especially here in Houston, and it's put under extraordinary duress by climate crises, which I am, terrified that we will have a bad hurricane season this year, and that has a disproportionate effect on poor folks and people of color. So it's as Dr. Wagner said earlier, it is truly all connected when we get to these issues. And I'd like to just mention, we talked a little bit about the Dreamers earlier, and we also talked about the LGBTQIA community. HUD, which oversees and provides funding for cities over $50,000 to do housing and community development work, has actively, under Ben Carson's leadership, tried to discriminate against trans folks trying to enter into HUD-funded shelters. And we know that trans people have higher rates of homelessness. And they've also sought to remove mixed status families where some people might have full legal documentation to be in the country and some might be undocumented or less documented. They've also sought to remove them from voucher programs and public housing. So we think about, if we want to talk about the policies that get to the social needs of our nation, and housing certainly being one of them, we see that the people in charge absolutely matter, and the values that they lead with are critical. And that's something that's lacking. It was lacking before this administration, but in terms of housing is just on full display right now under Ben Carson's HUD.
Yes, indeed. And Daniel, if you're listening, I'm trying to get to some of those questions. I don't quite know how to do that. But on another issue, militarism. Of course, you hear President Trump quite a bit talking about how much he's built up the United States military. And there's a lot of concern as to whether or not all of this militarism is going to possibly lead to World War III. And Ali, if you could weigh in on it from a political point of view, militarism, I mean, do we still have an arms race going on this planet? Can we afford that?
I don't know if I can fully knowledgeably speak to that in my professional capacity. I have a lot of personal opinions, but I will say that around, the president's deep enthusiasm for militarism, TCRP has been having a lot of internal conversations around scenario planning of what things are going to look like in the next 1 to 2 to 3 to 5 years, around the political climate at the federal level. And those are things that we are preparing for that. So I think that's all I'll say on that. But we are doing our best, sort of across all 3 of our departments and across all of our social justice work to really prepare for quite literally anything.
My goodness. And Diana Flores, some of your concerns about militarism. I mean, for a lot of our young people, they're being told that this is a way out. Join the military. But at the same time, I think there was recently where the administration made a move on members of the LGBT community to strip certain military rights and all that kind of thing. But Diana, are you concerned about militarism and the fact that we're spending a lot of our resources on the military?
Well, we know the type of budget they get, like the meme that went around in social media several years ago. Anytime the military wants to get a new bomber or airplane, they don't have to do a bake sale, like the PTAs, et cetera, do. So yes, there is a concern about militarism. And I think what happened tragically with Mr. Floyd and what's been happening with other men of color has increased the awareness of the community, because it's being reported in the media of how our police forces have become militarized because of the government making this military equipment available to them. So that's a deep concern. But Mr. Ashley, if you'll allow me to, I'm going to cut to the quick.
Yes.
All of these issues we could resolve if our people, and by our people, I'm saying those that are marginalized, those that are in poverty, those that have come out of poverty, et cetera, those that are not the super rich. If the majority of us would get out and vote, we would control the politics of this nation. Locally, at the state level, and at the national level, because there's certainly many more of us than there are of those who are in control right now. But it's not enough to just take political control. Then we have to really enact and root out those systemic practices, policies, laws, ordinance, et cetera, that work against regular working people, that work against poor people. We need to connect the dots. Our people need to connect the dots and get out and vote in each and every election and fully and finally take control of this nation and get money out of our politics.
Well, I'll tell you, you got a point there, Donna, because, back in 2016, Hillary did win the general election vote. It was just the Electoral College, so Democrats and many others who turned out in numbers. But getting to Dr. Brian Williams on this militaristic conversation that we're having, Dr. Williams, some of your thoughts. Are you a vet, sir? You've served this country? I see, Dr. Williams, can you hear us, sir? I think you're on mute. Doc. Check your mute button there.
There we go. Sorry, I was stuck there for a second.
Yes, sir.
So I'm a military veteran, graduated from the Air Force Academy and served, and my father served 20 years, come from a long line of vets. And if you're a historian of military history, talk to military historians, there's never one single event that happens and all of a sudden, okay, this happened, now it's World War I. This happened, now it's World War II. This happened, now it's the Vietnam War. It's insidious. There are events that are leading up to it that are happening around communities and countries that we're not really taking notice of, and then you find yourself in this international armed conflict. So we ask, can what's happening now, lead to World War III? There's never a time where everything's fine before you flip the switch and you're in a war. Things could be happening right now that are leading up to that, or become part of our daily lives that we start to take for advantage. And we've talked about many of them already. The economic disenfranchisement, the voter suppression, the impact of COVID on marginalized communities. These things start to transform society and amplify inequities, and this is happening on a worldwide basis. So that could be the preamble for something. I'm hoping not. I don't expect that. But there's never just one precipitating event where we wake up one day and now, oh my gosh, this is an international armed conflict.
Yeah, because as we look at President Trump, Putin, the Russians, all the talk here about the Russian collusion, been watching China and India, watching China in the South China Sea. But then again, but as a military veteran, our military resources, what do you think, Dr. Williams? Are we spending too much on the military? Are we spending not enough, or do we need to reallocate some of those resources to help the poor? Or are we doing okay right now? Are you satisfied with how President Trump's handling his military budget?
Well, I don't really know the details of the military budget. I will say that as a veteran and the people I've served with, we all want to be prepared for war if that comes. If we have to go to war, we want America and American citizens to be protected and win. But we all hope that we never actually have to go to war. We don't want to do that. We're not itching for that. But if you must, do it right. But as a humanitarian, as a medical professional, I think the desire to precipitate death in anyone, whether they are Americans or not, whether they are friends or foe, is not something to be celebrated. It is not something that we should advocate for. So let's create a society and a world that wars are not even an option. And if we can eradicate the inequities that exists right now, that'd be a step towards that. So the police brutality, the economic impoverishment, the education inequalities, let's start talking about uplifting communities instead of destroying them.
Yes, indeed. Well, as we get ready to kind of wrap up, I think we've touched on all of the major demands. Is there anyone on the panel who would like to
Mr. Ashley?
add something in? Yes.
This is Daniel from Behind the Scenes. We had a question come in via Facebook, and I'm wondering if we could have a minute for all the panelists to answer it. The question that came via Facebook was, how can communities work together to overcome police brutality and other issues we are seeing that impact more people?
Okay. Dr. Waggoner, you'd like to start on that?
Well, I think that one of the first things we have to do is understand that even if we've escaped poverty, the things that affect everybody in our community affects us all. So if you, some person in your community is ill, it affects everybody. If you have people that are marginalized in any way, then that affects us all. It affects our workforce. It affects our healthcare. It affects everything. And so the first thing is we kind of change our focus from ourselves. One of the things that I've watched was just wearing a mask. The information came out that if you wear a mask, you protect those around you. And so many people, because they are so self-involved and so self-absorbed, they choose not to wear a mask because they don't care about the people around them. They are focused on themselves. And I think that is just a spotlight of what we are, or a small indication of what we're dealing with. We all really have to think about the other people. And so even if you do not find yourself homeless, or even if you do not find yourself without a job, or even if you do not find yourself in a community that doesn't have healthy food to eat, it is our responsibility as human beings to make sure that everybody has the same right to just basic human needs. And if we start from there, of course, politics are part of it, because we have to be political in order to make these things happen. But it does not matter whether we differ in our politics. What matters is that we operate from a place of human caring and dignity.
All right. Ali, would you like to chime in? And we'll just go from Ali to Zoe. And
Yeah, sure. Thank you. I think something that I think about a lot, a quote that I think about a lot, is a quote from Representative Ayanna Pressley. And she said, "The people closest to the pain should be closest to the power." And I have been thinking about that quote a lot in the context of this moment and these protests and these uprisings. And I think the way that communities have come together right now is really what we need to continue to see. And if anyone saw the article that came out around the drastic shift, I mean, the unprecedented shift in public opinion around the Black Lives Matter movement, they saw an increase in support in the past 3 weeks that was equivalent to the support that they have seen over the past 2 years. And that was not because of poll testing of slogans from consultants. It was because of the activists who have been on the ground doing the work for years and years and years. And so I think how our community has come together is we're seeing it right now. And not only that, but we have seen, and I've been having so many conversations around folks who disagree with the quote unquote slogan around defund the police. Mm-hmm. And I mean, when you take a look at just the list of actual policy achievements that the movement for Black Lives has achieved in such a short amount of time of just a few weeks, the narrative is working. I mean, we are winning the narrative war. So I think the most important thing is going to be for communities to continue to put the people closest to the pain, closest to the power, and to listen to organizers and really hold elected officials' feet to the fire, and demand political courage, not only in the short term, but in the long term. This is definitely a marathon and not a sprint.
Yes, indeed. Zoe?
I love that quote too, Ali. I have it like scrawled all over my notebook. I will say a few things. I think first, this people that are just joining this work or getting excited about this abolitionist work, like there's a giant field of study. So spend time doing deep study for yourself. Think about the personal experiences and the values that bring you to this work. Get really clear on them, because those values are so much more powerful than any kind of fear you have. And I think that it's really important to find a political home, that people don't go it alone. And I don't necessarily mean a political home as embodied by one single candidate or one single party, but a set of beliefs that you can fall asleep soundly at night knowing that you've attached yourself to them, and to adopt really an ethic of care in all things. And I think for people that are, as we're seeing protests continue, I spent the last couple of weeks doing jail support, and if you people are looking for an entree into this work and they feel comfortable leaving the house, you can do jail support, and it provides you with a sense of what the alternatives are. And it's no surprise that today in Charlotte, people running jail support were shut down and were arrested for giving water to folks and other stuff. But it is an absolute, absolutely, if you're not already radicalized, it is an absolutely life-affirming thing to do. But there are, of course, other things you can do. Everyone's gifts have a place at this current moment, and everyone's pain has a purpose in this moment. And the important thing is to not give into our fear or give into our shame, but really move